So to start, just kind of an overview, we're going to kind of briefly try and touch on a lot of different points, but realism, kind of an overview of the realist approach, realist synthesis, realist evaluation, and then we'll have hopefully time for discussion and questions at the end. But if you do have any questions or comments that come up along the way, feel free to put them in the chat. So what is realism? Well, it's not, I realize, maybe the easiest, straightforward thing to answer or definition. There are many different schools of realism. It is an alternate way to account for the nature of reality. And it lies somewhere between positivism and constructivism on the epistemological kind of timeline. So just kind of briefly on those two, so we kind of know where realism is in the middle of them. Positivists say that there is an objective reality that exists independently of human interpretation and governed by natural laws, and that the observer and the observed are independent of each other, and that we can identify facts about reality through a cycle of observation and theory. Therefore, only that which can be observed is considered a valid source of knowledge. The positivist role is to identify and report observed facts. On the other side, we have the constructivists, and they assert that all knowledge is socially and individually constructed and interpreted, and therefore we can never be quite sure what reality is like or even if it exists. They are mostly concerned with meaning and interpretation that human actors give to experiences. And their role is to identify and report meanings. So we have realism, which again falls somewhere between these two poles. So realists agree with positivists on the existence of a mind-independent reality. And then on the constructivist side, they agree that there is a degree of interpretation in the world and that we never have a full understanding of what the actual is. Kind of within the actual, there are causal processes, mechanisms, which we'll get into a lot more later. And below that is the actual, where we can observe things. And the distinguishing factor about realism is that it is an understanding of how causation works. The role of the realist evaluator is to explain how and why programs or policies cause their various outcomes in different circumstances. So realism draws from many different, realist philosophy of science draws from many different realism thinkers. But again, it really stresses on the mechanics of explanation, using explanatory strategies to lead to a progressive body of scientific knowledge. It focuses on exploratory elements, which are often overlooked by experimentalists. And they assume that all social systems and structures are real, and that actors respond differently to interventions in diverse circumstances. So there are some key assumptions in the realist philosophy. First, that both the material and the social world are real, and anything that can have real effects is in itself real. Therefore, programs and policies are real and can have real effects, and that social institutions and constructs can have real effects on whether and how programs work. Second, the existence of a mind-independent reality. The natural and social worlds are independent of and interdependent with our understanding of them. And both the powers and liabilities of systems and the interpretations that people make may be relevant for an evaluation. Thirdly, all inquiry and all observations are shaped and filtered through the human brain. There is no final truth or knowledge. And so we will never reach complete certainty, but we can work towards a closer understanding of the nature of reality. But because reality itself constrains the interpretations that can reasonably be made of it, evaluations can just work towards a better understanding of whether, how, and why programs work, but we'll never have like 100% proof of a definite conclusion. Fourth, all social systems are open systems. Boundaries are porous and flexible, and any outcome that's observed will be the result of an interactions within and across systems, not just an outcome of a program or policy, but you can show that a policy or program contributed to an outcome. 5, realism offers a particular understanding of how causation works. Evaluations try to identify the mechanism, which is usually a non-observable process that causes program outcomes. 6, realism provides a specific way of thinking about context. The ability of a mechanism to generate outcomes depends on context, and evaluations identify what it is about the context that determines if and which mechanisms fire. And lastly, mechanisms operating in context generate outcomes, and evaluations seek to identify and explain how and why different outcome patterns are generated. So now a bit of an overview on the realist approach. You will see this question in red kind of repeated throughout the presentation and different parts of it as well, kind of what works for whom, in what respect, to what extent, in what context, and how. And this is kind of like the overarching realist question. So why do a realist approach compared to taking another type of research approach? Well, there's a need for research approaches that are sensitive to contextual complexities of the problems, and the need to take into account context, which can help generate an understanding of which components within an intervention matter more or less for whom and in what ways. It also enables us to understand social programs, initiatives, or interventions. And it also acknowledges that programs are not universally successful and may work better in certain contexts. So in realist research, there's two main types. There's realist synthesis and realist evaluation. Realist synthesis is the literature review and synthesis of existing evidence, while realist evaluation is a realist approach to evaluation. There is no one standard formula for doing realist research, but kind of the main underlying thing is that there is a clear theory of program mechanisms, context, and outcomes. And kind of the common thread that runs through different designs of realist research is to continue to get more detailed answers to why a program works for whom and in what circumstances. At the end of the presentation, we have a link to the Ramsey's guidelines for reporting that Geoff and colleagues put together, which are kind of helpful for outlining the reporting processes for realist research. It can also be a guideline for design. So a couple of kind of key terms in realism. So in realist research. So theory-based evaluation. So realist evaluation is theory-based evaluation. And a theory-based evaluation is a set of belief and assumptions that underline the program activities. It focuses on making connection between the theory and actions more explicit, allowing for an exploration of the change process that led to the arrival of an outcome. It helps to make sense of the changes produced by a program. It can help make the process more transparent and help to understand how a program works. And the program theory kind of lays out how to design and implement the program, and it explains how the program should work and under what conditions. So realist evaluation often tackles kind of complex interventions. So what is a complex intervention? Well, according to the Medical Research Council guidance, a complex intervention is an intervention with many interacting components, kind of difficult and various behaviors that are required of those delivering or receiving the intervention. It can composed of different groups or organization levels, have a variability of outcomes, and there's also a degree of flexibility within kind of the implementation of the intervention. So complexity, according to realists, Realists can be kind of remembered by this moniker victory. And this was come up by Ray Paulson, who's one of the, say, the grandfathers or so of realist, the realist approach. So programs are, there's volition. People make choices that give us outcomes. Implementation programs have long implementation chains to get to an outcome. There are like a lot of things that sometimes need to happen. There is context. Outcomes are context dependent, and context influences outcomes. And the realist process allows us to link context to outcomes, but context is pre-existing at all different levels. Time, programs and interventions come from somewhere. There's lots of outcomes: desired, undesired, predictable, unpredictable, intermediate, different outcomes along the way. Programs don't exist in a vacuum. And so they are other programs that could be ongoing, kind of in parallel to your intervention. And they all interact with each other. And lastly, emergence. Things change, which makes interventions more complex. So probably the three most important, say, terms within realist research is context, mechanism, and outcomes. Context is the backdrop of programs and research. Conditions can change over time, and so the context may reflect aspects of those changes during implementation. Examples of context can be cultural norms, program infrastructure, geographic location, funding, et cetera, et cetera. Mechanisms are the interaction between resources created by the intervention and the participant's reaction or response, or lack thereof, to the intentional offer of incentives, actions, or other resources. Mechanisms are always there, but they may be invisible, and they explain how and why programs give rise to outcomes. So for example, we have here a picture of this small child, and he's standing on a desk, on his chair, his school chair. And so that's the context, so that can be considered the context. And then the outcome and the intervention is that he has this ball, and he's going to drop the ball. And the outcome is going to be, well, that the ball is going to be on the ground. But what is the actual thing that causes the ball to go from being up in the air to down on the ground? And that thing, and that's the mechanism, in this case, is gravity. So the mechanism would be gravity. So that's kind of like a simplified explanation, example of kind of what a mechanism could be. Something, gravity is always there, but we can't necessarily see it. And then outcomes. So the outcomes that are assessed, they could be intended, intermediate, unplanned, unexpected. Sometimes unplanned outcomes could have a greater influence than actually those that the program was focused on. So what is a CMOC? So context plus mechanism equals outcome. And so it's the interaction between the context and the mechanism that enables a program's impact or outcomes. And these, they're organized, these kind of three terms or concepts are organized often in what are known as context, mechanism, outcome configurations. And Claire is going to talk about some of the realist work that she's done, and she'll give an example of, examples of some of the CMOCs that she built. And they generate causative explorations about the outcomes in the data. A CMOC could be about a whole program, or it might only be about certain aspects. They can be embedded in each other or linked. One outcome for one CMOC could be the context for the next. And they're the basis for generating or refining the program theory. So realist synthesis. So just a quick definition. Like I said, it's a literature review and synthesis of existing evidence. It's a theory driven review, drawing on diverse literature sources from data within qualitative, quantitative, and mixed methods research. And it can lead to finding, explaining how and why context influence outcomes while taking into account different dimensions of the problem and the heterogeneity of approaches and interventions. So there's no, like I said, there's no necessarily like set formulaic way to do a realist synthesis, but these are kind of like the five kind of main steps within the process, some of which are quite similar to other types of literature reviews. But for realist synthesis, you start with finding existing theories that explain how interventions are supposed to work and for whom, when, as well as when they do not work, why are they not effective or why they're not being used. Once you have your theories, then you search for evidence, so database searches, citation tracking, inclusion, exclusion criteria. And then in terms of the selection of the sources of evidence, you look for things that are most relevant in terms of the data that can contribute to building the theory or testing it, and also that it's rigorous. So the methods that have been used to generate the data. Data is extracted and organized. In vivo can be used to code selections of text as context mechanism or outcome. And then the data, the evidence, the extracted data is synthesized, and CMOCs are built to explain outcomes, the observed outcomes in the literature. And this is an iterative process. So if you get kind of to the point and you're building CMOCs and you realize, well, actually there's gaps or these things don't make sense, then you can, go back to searching for evidence or go back and looking already at all the evidence that you have and looking at different pieces of data. So it's kind of an iterative process until you feel like you've kind of reached saturation. So now over to Claire to present some of her work on realist synthesis.
Hi everybody. So yes, I'm going to present my realist synthesis, but before I do, I thought I'd just explain why I chose realism. So one of the reasons is because of the way that realism, as Katherine sort of already explained, looks at complexity. So the more traditional way of like RCTs, randomized controlled trials, etc., have a lot of assumptions that the intervention is causative of the outcome. But realism recognises that there are other things at play in causing the outcome, and actually, so you can see here in the quote, in the realist view, social interventions are always complex systems thrust amid complex systems. And actually, randomized control trials have sort of come across this, if you like, in that the same intervention in different places that might look quite similar have sometimes produced quite different outcomes or different sort of degrees of outcome effect. And there is something about the detail of particular settings that matters. And part of this detail includes the software of hospitals, particularly so things like relationships and power, values and norms, interests and ideas. And this is kind of my area of interest, if you like. And those of you who attended the social network session might remember this slide. So I'm particularly interested in the social ties that people have in the workplace. So the people that others go to for advice, where influence lies within the workforce, and how people make their decisions, which leads to quality of care. So realism tries to find transferable learning in variation, which is quite different to some other approaches. And as Katherine sort of said, most things have been found sometimes to work. So the realist approach asks how, why, for whom, to what extent, and in what context. And particularly looking for demi-regularities, which are these kind of patterns where things sometimes work. And through identifying these context mechanism outcome configurations, then one can try to find targets for intervention. So by slightly manipulating the context, for example, in particular circumstances, then different mechanisms, different causative mechanisms would be fired to produce different outcomes. And I won't talk about this in detail, but I personally find this diagram really helpful in trying to sort of think in my head about how data is used to build theory in realism. So realism takes different types of data to build arguments, and from those arguments theory is developed, and that's that program theory that Katherine was talking about. And as Katherine mentioned as well, she talked about a long implementation chain of programs. Well, there are different kind of places to stop, if you like, along the path of causation, and part of program theory building is trying to decide where one will focus along that sort of long chain, and also trying to organize these context mechanism outcome configurations that are produced into an order that builds understanding. So, I've got a slightly different, I've missed out a slide on here, but anyway, oh no, I haven't, it's coming up. So the aim of my review was a bit different. So I wasn't looking at a program as such, I wasn't looking at an intervention program, but I was looking at this kind of software issue in hospitals and trying to understand the software more. So the aim was to develop a way of understanding the social networks that exist between staff in hospitals using realist synthesis. So my question was how, why, for whom, to what extent and in what context do the social ties of staff within a hospital influence quality of service delivery, including quality improvement? And this is my rogue slide that I thought was before. So first of all, before I did my literature review, I looked at a lot of existing sociological theory. So I looked at a lot of existing sociological theory, and then I developed an initial program theory from reading all of that theory and also from my own personal experiences of working in hospitals. And from that program theory, I sort of thought about how I might construct my literature review. So with the help of Ellie from the libraries, I searched using synonyms for health worker and social networks, lots of different databases. And I included empirical studies that used a form of social network analysis in their methodology that people will remember, hopefully, from the social network analysis session. They were conducted in hospitals and focused on the social networks of staff. So there were about 11,000 citations and 75 documents were included. So 75 documents were included. So some reports collected data from just doctors, some from just nurses, but mostly from more than one professional group. And different studies focused on different types of communication ties, for example, medication advice seeking, support with decision making in the workplace, etc. Most studies used a name generator method to collect the data, which you might remember from the session a few weeks ago, and with 30 reports using a roster method. So this is basically giving people a list of people that they work with and saying, who would you go to ask about X? So most of the included documents were published fairly recently, and most were from high-income countries, with a few from upper-middle-income countries. So here's how I analysed the data. So from these 75 documents, I sort of had an initial selection of documents that I started coding inductively, and I used NVivo for that. And then after I'd done 25 articles, I tried to summarise them on flip chart paper and try and refine those nodes, those codes. And then I used those to continue coding, and I also kept doing inductive coding. So then I tried to visualize them again, summarize them, and on whiteboards, which I'll show you in a minute. And that was when I tried to start this kind of explanatory process, try to identify these emergent explanatory pathways, which realism obviously is all about. And then I tried even to put these in sentences. And then I did some cutting and sticking and tried to make sure that they weren't duplicated and tried to sort them out. And then I used those to refine my codes again. And then I used those refined codes to code my remaining articles. Then I again mapped onto these explanatory pathways, tried to enrich them, expand them, and then collapse ones that were very similar. And then from that, I configured my context mechanism outcome configurations. And this is one of the whiteboards, so I had lots of these, trying to make sense of the data that I'd coded and the codes that were coming out, trying to make sense and then arrange them in these kind of explanatory pathways. And this was trying to make sure that things weren't duplicated, refining the explanatory pathways. And then once I had my CMOCs, I then tried to refine these further by reading and rereading them, speaking to lots of different people about them. We had a student realist group, so we were presenting our CMOCs in that. And then I tried to build my program theory from that. And then I went back and coded all of my data again by CMOCs. And then from those CMOCs, I built my program theory based on importance, relevance to potential intervention and strength of supporting data. And I'm not going to go through my program theory completely, but just to give you a few snapshots. So this was the program theory, and there were 4 domains that were kind of emergent from the data as well. And within those 4 domains were 35 context mechanism outcome configurations, and the domains were social groups, hierarchy, discourse, and bridging distance. So just in summary of the social group domain, there were 13 CMOCs within this domain, and the summary of the whole domain was that hospital staff prefer to communicate with colleagues who are similar to themselves and with whom they share trust. However, this can create boundaries, silos, and redundant information within pockets of the workforce, and different behavioural norms adopted by members of different groups dominated by influential individuals. And then in the hierarchy domain, there were 11 CMOCs, and the kind of summary of this domain was tacit hierarchical rules also determine communication with others in the workplace based on status, forming a landscape of differential access to information and others. Fragmentation between different status groups can occur, and space for status enhancing behaviours is created. So I'll just go through 3 CMOCs just to give some examples. So this is my first one, and you can see that they're kind of different places along this chain that I had the slide about before. And Katherine mentioned that sometimes an outcome can be a context for another CMOC. So that's why the program theory building, that's part of the process of the program theory building too, to order these CMOCs. But this is CMOC 1. When healthcare workers share a common identity, that's the context, they'll be more likely to trust one another, which is the outcome, as they share an underlying representation, and that means a way of looking at the world, basically. And this is an illustrative quote from the data. Social tribes, like professional tribes, are split along professional lines. People are closer to and interact more readily with those with whom they identify, trained with, or share practices with, and to whom they are ideologically and attitudinally closer. Here's another example. This is from the bridging distance domain. When a healthcare worker observes a non-peer colleague displaying their being careful, which is basically being nice, that's a context, they will exchange required information with this colleague, the outcome, because they feel trusting towards the colleague, that's one mechanism, and feel comfortable approaching them, another mechanism. So relational influencers are typically influential because of their people skills and relational communication expertise. And then one more, and this is in the discourse domain. The perceived values of an organisation, context, facilitate the creation of status differentials within the workplace, outcome, because individuals benchmark their activities and identities against how much they embody these values, the mechanism. So, and a quote, esteem is tied to work tasks. At top hospitals, the focus is on removing doctors from the clinic so they can capitalise on their pedigree by publishing and speaking at conferences and grand rounds. In the lower prestige hospitals, the esteemed physicians sustain the local patient base. So the strengths and limitations, it was a comprehensive search. Analogy with existing theory. So this means that that the findings really chimed with a lot of different sociological theories in different ways. But I suppose I drew on lots and lots of different sociological existing theory within this kind of work. And there was analogy within those theories. Consilience means that the theory can explain most of the data, which it could. I refined the CMOCs in different fora. Different types of social tie were included in the data, and then I had a stakeholder group which comprised of some people from Sierra Leone and Kenya who had expertise in health research or had a lot of experience in the healthcare setting, and were kind of had relevant knowledge and expertise to this review. So they were kind of, I used them as a bit of a sounding board to check that my interpretation and the way that I was approaching the review was made sense and was kind of sound, aligned with their own understanding. And the limitation was that it included studies just from high income and upper middle income countries. So in conclusion, individual healthcare workers are subject to their social position in the workforce at large, determining both their access to information and support from others and the possible actions available to them. And that's, I haven't talked about that bit, but that's very interesting if anyone's interested in the future. Potential targets for intervention are identified for improving communication and distribution of influence and power, and thereby supporting behavioural change and quality improvement initiatives in hospitals. So my next steps, I'm hoping to do a realist evaluation, focusing on neonatal units in Kenya, to conduct some kind of exploratory work, also a social network analysis, and then use the findings to refine the theory, to have some sort of practical working theory. And the idea, the kind of purposes of the theory would be, number one, to as a way of understanding this kind of software aspect in hospitals. So like the glasses here, trying to make a bit more, or trying to find some way of understanding this quite difficult tacit area of health systems. And then also through understanding better these causative mechanisms and trying to understand which context might be amenable to intervention, to try to fire different mechanisms to lead to more desirable outcomes. So that's that done. So let me pass over back to you, Katherine.
Great. So now kind of the second piece, realist evaluation. So just a brief definition, realist evaluation emphasizes an understanding of causation and how causal mechanisms are shaped and constrained by context. Because we've said programs are believed to work in different ways for different people in different situations. And a realist evaluation enables a discovery of what works for whom, in which contexts of particular programs do work and don't, and which mechanisms are triggered by what programs in what context. It analyzes the links between intervention mechanism and outcome, which increases the explaining power. And the identification of essential context elements helps improve the usefulness of the findings for decision-making and other settings, which therefore increases its external validity. So programs are theories incarnate, and programs are normally underlined by one or more theories about what might cause the change. In realist evaluation, the theories are made explicit through hypotheses about how, for whom, to what extent, and in what context a program might work. And then evaluation of the program refines and tests these hypotheses. Realist evaluations can often use detailed case studies to help analyze how interventions work and in which conditions, which can make case studies more useful to managers and policymakers. So again, kind of these, there's no set required steps, or kind of set sequence of steps, but these are kind of, again, the overarching steps that are normally done in a realist evaluation. And so you start with a formulation of an initial program theory. This could come from an earlier realist synthesis, realist review, if you've done one, but you don't necessarily have to do a realist synthesis to then do a realist evaluation. But you start with your initial program theory, and then the design of the study, you could use a case study approach, but the study design can also be an adaptive process, and so things can be kind of changed along the way. Data collection is qualitative, quantitative data. Then the data to develop the CMOCs and refine and test them. Which enables a deeper and more detailed understanding of what works for whom, in what circumstances, and why, But this is an iterative process, so you can kind of continue to go back and refine them as you kind of piece the data together. CMOCs can be compared within programs or across implementation sites, as well as kind of across different locations or participants, to see why a program might work for one group of participants or in one location and not another. Then the CMOCs are used to refine or refute the initial program theory, and you can then draw out lessons learned or best practices. So Realist data collection enables the testing of these hypotheses. Data is collected on program impact, processes of implementation, aspects of program context that could lead to outcomes, and when data is collected from different stakeholders, so different stakeholders have different perspectives, different information, and different understanding about how programs work or if they do. And so kind of a Realist interview is when a stakeholder or participant is fed like the initial program theory or CMOCs, and then has the chance to kind of respond to them and say, yes, this resonates, or yes, this makes sense, or actually, no, this is not how it works. And so that kind of program theory kind of guide the interview process with stakeholders. As I said, both qualitative and quantitative data are collected. Qualitative data is mostly used for mechanisms, context, outcomes, building the CMOCs, explaining patterns in the quantitative data. The quantitative data is mostly on impact and for identifying patterns in the data that need to be explained. So some examples of Realist data collection methods. So kind of coming back to this overarching question, it can be broken up into different parts which link to either context or mechanism or outcome or impact. And then there's examples of different types of data collection that can be used to answer different pieces of the Realist question or to find context, mechanism, impact. And then in terms of the data analysis process, again, this is not a process that's set in stone. Like, you can follow it, but it's not set in stone. But just kind of briefly, in terms of the data analysis process, you start with familiarizing yourself with the data sources that you have, deciding, is the data relevant? If not, then you have to go back and relook at the data, or if it's primary data, or if it's this is applicable for Realist synthesis, go back and relook at the literature. Then you make judgments about the trustworthiness of the source of the data, and identify then within the data, is it about the context, the mechanism, or the outcome? And if it is about one of those, which CMOC could it contribute to? And then see if the data tells anything about how the CMOCs relate to each other in the program theory. And you can do this until you've kind of reached theoretical saturation. But again, it's an iterative process. And so you can kind of keep going back to earlier steps as you need to until you feel that you've reached saturation. So back over to Claire to talk about an example of Realist evaluation.
Thank you. So I haven't done my Realist evaluation yet, but Geoff very kindly sent us some very good examples of well-conducted Realist evaluation. So here is one, and I picked this one because I recognised some people from my old job, so I thought I'd have a read. So this was a study called the Revamp Study, Determinants of Effectiveness and Sustainability of a Novel Community Health Workers Programme in Improving Maternal and Child Health in Nigeria. And it was a longitudinal Realist evaluation, and it was evaluating this SHORE-P MCH programme in Nigeria, which was a government scheme to reinvest some money, I think, to do with fuel in partly in maternal and child health programmes, and it ran between 2012 and 2015 with the aim to improve child and maternal health outcomes. And it was conducted across Nigeria, that this particular programme, that the intervention clusters were 4 primary healthcare facilities and 1 general referral hospital, so that was like a cluster. And the intervention included supply side interventions and demand side interventions. So on the supply side, there was staff recruitment and training. There were additional midwives and community health workers. There was some investment in infrastructure, supplies, and there were these ward development committees. And then on the demand side, conditional cash transfer payments were made to pregnant women. So the Realist evaluation was mixed methods. There were quantitative methods, surveys, and looking at the data, HMIS, and then qualitative document reviews, in-depth interviews, and focus group discussions. And the evaluation was conducted in 3 phases. So I'll just briefly describe each phase because it's quite interesting. So phase 1 was a few months long, and the researchers initially had some discussions with the designers of the programme. They reviewed the programme documents. So this is this national programme to try to improve maternal and child health outcomes. They looked at the HMIS data, and then they also did a health literature review, which I think was quite a sort of, it sounds from the paper like it was a less in-depth literature review than later, but they did this initial literature review on health system strengthening to improve maternal and child health in low and middle income countries. Then they had this project meeting in Leeds where they discussed between the different partners, and they also did quite lots of capacity building in Realist evaluation with Cascade workshops in Nigeria. And from that phase 1, the output was that they had this logic map of the programme and some initial working theories as a group. Then phase 2 took them quite a bit longer than phase 1. They did an in-depth literature review. They did 96 in-depth interviews. They looked at costing data, and they did a facility exit survey. And then with that data, they analysed it in 5 different groups over a period of 4 weeks, which is very impressive. And then they did a 2-day data harmonisation and theory building workshop in Nigeria, where they sort of got together and discussed everything that they'd found. And then they produced these 15 inductive themes, which informed the development of 8 programme theories. And these programme theories were then refined through peer review, and then looking at literature and contrasting. And the programme theories that they had refined informed their next stage of data collection. And the data was then coded. The data that they had, they coded it by CMOC for each programme theory that they developed. And then they also did more capacity building workshops in Realist evaluation. And they had this continuous exchange between the collaborating teams, which was part of this Realist evaluation process. So the output from this phase 2, were 8 theories articulating causality, which they'd put in the format of in the context of, if, or when. And this particular paper was just focusing on 2 of these programme theories, and the 2 programme theories that this particular paper focused on were security and trust. So at this stage in phase 2, security was a clear programme theory, but trust wasn't actually still in phase 2. So trust cut across several of the programme theories that they had at this stage. Phase 3, last one, again, took a while. They did some more in-depth interviews, but fewer. And this focused on, as Katherine was saying before, trying to test these programme theories that they had. So they were particularly focusing on the causal links that they'd identified within the programme theories. They did 4 focus group discussions, and then they did a household survey to capture, because they realised that they hadn't captured people that hadn't been attending the health facility. Then they had a team meeting, discussed and refined their programme theories even more. And now at this stage, at this phase, then trust and security were now both distinct programme theories. Then they drew heavily on social science theory. So I think they really now really looked in depth at existing social science theories to help to identify mechanisms within their program theories. And then they did several rounds of theory testing, refinement, consolidation through their data collection, the analysis, and their literature review that they were doing alongside. So this is their phases: phase 1, phase 2, phase 3 at the top. And you can see that they ended up, well, at phase 2, then they had these 8 program theories in phase 2, and then refined those for phase 3. And they've highlighted trust and security. So they had, as I said, they had this security as a program theory in phase 2, but trust was sort of distributed across several program theories. And then they consolidated it in this final phase 3 step. So this is their security program theory. So they have contexts, mechanisms, and outcomes, and they've tried to sort of link them as a chain, as a causative chain. You can see that they've got 2 boxes of mechanisms here as well, some of which interact. So there are some mechanisms that are kind of within the person, and then some that are part of the intervention that they've identified, and then linked to these particular outcomes. And then here is the trust program theory, and they've done the same thing here with the mechanisms. So in their discussion, they neither security or trust was specifically articulated in the design of the actual programme of this national maternal child health programme. So they weren't articulated as part of the kind of plan of that, but then they were identified through this as sort of key programme theories within this realist evaluation. The evaluation team were multidisciplinary. I think they had some health economists, health systems researchers, other disciplines of participants, but they all needed to share this, as Katherine sort of has mentioned earlier in the presentation, they all needed to share this ontology and epistemology of realism, of the realist approach, and that was addressed through their capacity building workshops. And then they remind us that realist evaluations reflect the applied nature of health policy and systems research, and they sort of stated in their reflections, if you like, that it's important to find the right level of abstraction. So when they were building their program theories, then the more, Geoff can correct me later if I'm wrong on this, but basically the more you abstract, the higher you abstract, if you like, then it becomes more generalizable, but then you might lose some of the detail that might be quite necessary. So they were trying to gauge this right level of abstraction between generalizability versus applicability to policy and practice. So they discussed about that. So let me move back to Katherine.
So that's kind of a very brief tour through realism, realist synthesis, and realist evaluation. If you're interested in learning more about realism and the realist approach, here are kind of the three kind of like seminal, I guess, textbooks on realist evaluation and realist synthesis by Paulson and Tilley. They said are kind of like the grandfathers of this approach. Geoff and colleagues have put together the Ramsey's reporting standards, and there's some really great materials on the Ramsey's website, in particular some fact sheets that kind of just give like an overview of what a mechanism is or what a context is that are really helpful, clear explanations. And then if you're interested in more on theory-based evaluation, Paulson and Tilley draw from or draw on Chen and Rossi and their work on theory-based evaluation. So that's it from us. Geoff, is there anything that you want to add maybe or emphasize that, yeah, that is really important. Maybe, or if not, that's okay. But yeah, just wanted to give you the chance to see if there's anything in particular you wanted to add or emphasize to this.
First of all, well done, an excellent presentation. I think the thing I would probably try to emphasize is that it's a sort of, it's quite a different way of thinking about data and making sense of the world. And that's often the bit which perhaps this is an area for discussion, which Katherine and Claire will be able to add to, and others. That's the bit that's the most difficult to manage in the way that it's almost like you're trying to think about the world in a different way. And the joke is, at the end of all of this, you might end up thinking like a realist, and then you can't not think like that anymore. So if it doesn't quite make sense initially, it's not you. It's about learning anything new or different and unusual. Just I suspect if you were asking me to learn advanced statistics, I'd have exactly the same problem because it's just not what I'm used to. So if it's something you're interested in, it can initially be quite a steep learning curve, but once you get there, it becomes almost kind of embedded in the way that you think. But it can take some time. That's probably the only thing I would say. But an excellent presentation. So well done.
Thanks.